So welcome to those who have joined us for this session, Becoming a Practicing Psychologist. I'm Ella Riley, a Macquarie University Student Ambassador. We have a really interesting session planned for you tonight where we'll share an exciting pre-recorded panel discussion followed by a live Q&A session with two of our speakers who are luckily here with us today. So on behalf of Macquarie, I just wanted to thank you both for joining us. We have Dr. Philip Gilchrist, the Program Director for the Master of Clinical Psychology, and Professor Mark Wiggins, the Program Director for the Master of Organisational Psychology. So welcome to you both. And before we get into the panel discussion, I just wanted to open it up to you both. And Professor Mark, I will start with you. Can you run us through why you became a psychologist and provide some insights into your journey thus far?
Thanks, Ella. That's a really interesting question, and Philip and I were just chatting about this before we came on. Philip, of course, is a clinical psychologist, and he'll talk about his journey. I'm an organisational psychologist, and some of you may know the difference between the two. It's a different specialisation. And I guess I was thinking about clinical psych as most of us do when we finish our undergraduate degrees. But when I started to sort of think about it, did a bit of work experience, I realised that perhaps working one-on-one for extended periods was probably not something that I would enjoy for forever. And so I became an org psych, and the kind of work that I tend to do in organisational psychology allows me to deal with mental health issues and other broader issues in organisations, but I guess at an organisational level. And it's not that I don't work with clinical psychs and clinical neuropsychs, I do regularly, but I like the idea of building frameworks within organisations and helping a sort of, I do deal with individuals, but I kind of like the idea of building structures and frameworks to build better organisations, making sure we don't have the problems that poor old Philip has to deal with later on down the track because people have had challenges. So my journey was initial clinical, but certainly I love being an org, but I do enjoy working with the other disciplines. What about you, Philip? What do you think?
Journey, actually a little bit vice versa in some respects. So I was contemplating org psych for a while. I was very close to pursuing it. I even considered pursuing it after I completed my master's. But so I did my master's in Canada. Registered afterwards and worked in different settings typical of a clinical psychologist, like hospital outpatient clinics, private clinics, rehabilitation centers, sometimes in multidisciplinary teams. So those are all very exciting. I think that's kind of typical of a clinical psychologist to work in these types of settings, and a little less so to work in the types of problems and situations that Professor Wiggins just described. Though I think sometimes there are important distinctions between the different areas of endorsement. There are sometimes also some degree of overlap. So I never worked as an org psych. I always found it interesting. So in the UK, when I moved there, I worked the NHS, so the health service over there, to test different ways to work with their patients so that they can reduce the stress and increase efficiencies with the way they handle patients and their service. And so some of that would have been great to have the expertise of an org psych. But I guess my point there is that sometimes there can be a little bit of overlap in some of the activities we do. Sometimes it may come across as though, if you're working with a patient one-on-one, it may come across as though the issue is actually something to do with psychopathology. But if you just get them back to work, for example, like with the help of an org psych, and integrated well back into work, suddenly the problem disappears. So sometimes it may appear as though it's a clinical psych problem, but it's an organizational one, sometimes vice versa. So I think optimally we work together when we can.
I mean, I think that's right. Yeah. I think that's right. Ella, you were sort of talking about the different journeys, but in fact, I think we really enjoy working as a team, recognizing there are opportunities and challenges, and there are potentially, you know your limits. And I've, in many cases, when I'm trying to get someone to return to work, I've realized that there might be a clinical pathology I need to deal with. So I'll refer to a clinical psychologist, or in fact, if it's develop a sort of a neurodegenerative issue, I'll refer to a neuropsych. And so we tend to work together. And I think the problem is that you often don't know what's going to suit you until sometime later down the track. And you, of course, poor old students have to make their decisions now. Am I going to go clinical or neuropsych? But you don't know what's going to suit you, unfortunately. So hopefully that's given people a bit of something to think about.
It definitely has. Thank you both. Oh, do continue if you have anything else.
I'm just going to give a quick word of reassurance that probably shouldn't emphasize this point too much, because you're here to understand the distinctions, and I could just make a quick couple of points on maybe what makes clinical stand out. But before I do that, I just want to reassure you that even if you make the wrong, in practice, there's a lot of diversity. Like a clinical, at least for a clinical psychologist, and I'm sure for org psych as well, it's not as cookie cutter as it is portrayed and sometimes in the media or even in career counseling. There's so much diversity in the type of work that we do. Some clinical psychologists, for example, they never do one-on-one psychotherapy. They engage in research, maybe just consultancy. Maybe they focus on policy. Maybe they focus on a more academic teaching type career. So there's many different types of paths. But what I guess what makes clinical distinct is the approaches to understanding psychopathology, assessment, and treatment interventions. And I guess in our program, the ability to integrate theory with science-based practice to help people with mental health issues. I'll stop there. Right.
And I guess, yeah, and I guess we would do the same in org, but at structures and systems. So if you think about it as two levels, you know, you're dealing with sort of individual, but then at an org level, we deal with structures and systems, but again, evidence-based. I think that's really important. I mean, that's a foundation of all the work that we do in the programs, is that evidence-based practice.
And I think that really highlights for students. And firstly, thank you both for that that great summary of what you both do and how you can interact with each other, even though you're both in distinctly different branches of the profession. But it's been really interesting to hear about how you can interact and you're not just a single entity, and how you can use those other professionals around you to your benefit. So thank you both, Dr. Gilchrist and Professor Wiggins, for highlighting that. And I found that very interesting, so I'm sure the students online have as well. If you do have any questions from what you've heard so far, please do just pop those Q&As in the forum at the bottom of your screen. So we will keep Dr. Gilchrist and Professor Wiggins on to answer any more general questions that you have, or questions relating to clinical or organisational psychology. If you do have any questions about professional psychology or clinical neuropsych, please still do put those questions in the Q&A forum. We'll pass them on to the other program directors, and we will email you the answers in a few business days. So regardless of what your area interest is, if you have more general questions, if you want to find out about something really specific, do just put those questions in the Q&A function at the bottom of your screen, and we will either answer them live or we will email you an answer from the relevant person at the university, which is great. So I will pass on to a pre-recorded video that we have. It is a panel discussion between Professor Joan Earle and two of our alumni. So they have pre-recorded this because they couldn't be with us this evening, but I'll hand over to Jacqueline Albert, who is my colleague in the Student Ambassador team, to introduce the video.
Hi everyone, and welcome to the Become a Practicing Psychologist session. My name is Jacqueline Albert and I'm a student ambassador here at Macquarie University. I'm very pleased to be joined by Professor Joanne Earle, who is the Program Director of Postgraduate Psychology here at Macquarie University. Jo will share her insights across our postgraduate psychology programs and her take on current trends in psychology. We're also fortunate to have two alumni with us today, and they'll be sharing their personal journey and experiences too. Dominic Jones completed the Master of Professional Psychology and is now a school psychologist with provisional registration at Junior High School. We also have Dayan Jaffer, or DJ as we like to call him, who completed the Master of Clinical Neuropsychology. DJ is now a PhD candidate and an upcoming clinical neuropsychology registrar in public health in New South Wales. Thank you all for being here today. So I thought we could get started with a question for Jo. So as you would know, at Macquarie, we offer master's degrees across 4 psychology areas, which are professional psychology, organizational psychology, clinical psychology, and clinical neuropsychology. I was wondering if you could please provide an overview of these degrees and explain the differences between them.
Sure. Well, it's lovely to see Dominic and DJ here too, so that they can share their experiences of the programs with us. So we have basically 2-year programs and 1-year programs. So organisational psychology, clinical psychology, and clinical neuropsychology, which is the program that DJ is doing, they're all 2-year programs. And then the 1-year program is a Master's in Professional Psychology, and that's the degree that Dominic's doing, has just completed. So they all vary in terms of the settings, the clients, and the issues that are being dealt with. So to give you a bit of an overview of each one, organisational psychology is really focusing on working in large consultancies or within organisations and improving employee wellbeing, at the same time trying to maximise organisational performance. Clinical psychology is more about having a diversity of population across the lifespan, and usually people with complex mental health issues. And you might, in that case, be working in hospitals or private practice. Clinical neuropsychology, which DJ will tell you more about, is all really about the brain, about assessment and treatment of cognitive and behavioural changes from brain damage, for example. And in that case, you might be working in hospitals or specialised brain injury units. And then the last one is professional psychology, which provides you with generalist registration as a psychologist. And in that case, you'd be working in a diverse range of different community settings. So, for example, schools, corrective services, maybe community health centres, hospitals, all offering general psychological services.
Wonderful. Thank you for that introduction. So my second question is for both Dominic and DJ. So firstly, for Dominic, what does a day in the life of a school psychologist look like? And DJ, what's it like working as a psychologist in the healthcare setting?
Hi, so with being a school psychologist with the Department of Education, you usually get more than one school. So I look after all the schools in a small town called Junee, just north of Wagga Wagga. There's 3 schools there, 1 high school, 2 primary schools. And then I also look after a primary school that's on the outskirts of Wagga. So a day in the life for me really depends on the school that I'm at. And it is a lot of juggling between sort of knowing the staff at all the different schools, knowing who your clients are, and really just trying to work it all together so at the end of the day, you can sort of look at it and go, I did some good stuff today. But generally, there'll be a lot of assessments in the primary schools because they want to know, how's their learning going? How's their cognitive capacity going? Less sort of counselling, which is good because counselling with small children can be quite difficult. And then we move into the high school where there'll be updated assessments for students depending on how they're going, but the majority of it does turn into that counselling deal. And in terms of what we can offer, because we're looking after around 500 children, we can't do regular counselling. So that becomes its own schedule of trying to figure out when we can counsel them or whether it's more appropriate to provide an external referral as well.
Yeah, so Jacqueline, to your question, it's a good question about what it's like being a neuropsychologist in the public health setting. Well, actually, I just want to go back, Joe. I think that was one of the best descriptions of clinical neuropsychology that I've heard. I don't think I can top that or add anything to it. But yeah, just the ability to work with patients that have incurred some sort of brain damage, and understanding how the impact of that brain impairment on their behaviours and day to day. So that's really what's encompassing. And in the healthcare setting, it's seeing patients of all backgrounds, of all presentations, and it's, I think, in the experience that I've had, also with my colleagues, it's just a great setting to develop a lot of the necessary skills that are required as a clinician, especially the healthcare setting. It's a really fast-paced, dynamic environment where you really need to build on your adaptive skills, your ability to build rapport and provide care in such a a fast-paced environment. And that can come with its own challenges. In healthcare, you've got the treating teams with their own timeframes, and you've got psychologists with their own timeframes of care that they want to, of the way they want to approach care. But it, with the set of challenges that it has, it is an incredibly rewarding space, especially to provide education and care to patients, especially to empower them about their own treatment, about their own well-being, about their own brain function, especially as a neuropsychologist. And as well, it's just absolutely amazing to work in such a really rich multidisciplinary environment with so many allied health professionals that are all sort of geared to providing like holistic care to this one patient. And I think that exampled with one of the coolest cases that I've done, where I was actually in the operating theatre assessing a patient whilst the neurosurgeon was actually conducting brain surgery, an awake brain surgery, which is really one of the few cool experiences that I've had. And just seeing how all the different sort of professionals interact with each other, the neurophysiologists, the surgeons, the anaesthetists, the neuropsychologists, the nurses, the other doctors, and just seeing how we all come together in this organized chaos to provide care to the patient. So that's what public health kind of looks like.
Yeah, thank you for both of your comments. It's really interesting to hear about the differences between them. And it's also exciting, I guess, for me as someone who doesn't have a job or do a degree in the psychology field, that there are all of these different options available to students that I didn't know about. So thank you so much for explaining that. My next question is for Joe. So psychologists are concerned about the pandemic's long-term impact on the mental health of Australians. So how do you see psychologists playing a bigger role in society? And does this mean the profession is in demand more than ever?
Sure. Well, obviously at the moment, mental health is centre stage, but even prior to the pandemic and to COVID, our students were in really high demand. As you probably heard from listening to the media, there are long wait lists for clients to see practitioners. And so consequently, as a result, a lot of our provisional psychologists are in high demand, even before they're finishing their degrees, for placements, but then going on to employment at the end of the placements that they do. Also, so that will mean that many of our students already have offers when they're finishing their course. And I think that's likely to continue for some time. But in terms of the growth and the opportunity for psychological positions, I think a lot of the jobs for the future haven't even been designed yet. And you have a look at an area like climate change, and who would have thought that psychologists would be centre stage in terms of talking about how to change people's behaviour to deal with climate change. And that's just one of the many applications. Human factors is another area where we've seen psychologists take a more increasing role. So I think that having a degree in psychology gives you a lot of flexibility and a lot of different career options for the future. Short-term employment prospects are good, but I think also in terms of opportunities to maybe move into different areas within your own field, there's flexibility to be able to do that as well.
Yeah, that intersection between climate change and psychology is really interesting. I hadn't heard of that before. So yeah, just one very fascinating trend that you just mentioned. Dominic and DJ, did you have anything else to add to that question?
For sure. In terms of demand for psychologists, to reiterate what Joe's been saying, I received a job offer before I'd actually completed my degree last year. And it was a job that, gives me supervision for free my supervisor is my boss. So supervision is a big worry for new provisionals that are out in the workforce because it can come at quite a cost. So if you do go into any sort of postgraduate degree, you're just giving yourself a better chance to get a better job. And in terms of all the nice things that come along with it, like supervision and having an experienced team to work with.
I think Jacqueline, the point that you made about, you know, the demand for psychologists, especially now, but even as Joe said previously, it's something that I think about even with, you know, my colleagues in this space. And I think there's sort of like two ways to approach this, or not maybe like two ways, but, you know, two sort of streams of thoughts, which is, you know, we enter this profession largely because we're going to want to try and support the well-being of individuals. So it's obviously really sad to see these increases in sort of like mental health difficulties that we are often seeing. But the other side of that is that obviously that also means that there's, you know, always a job sort of out there, it keeps us employed. And I think that, you know, that sort of contrast allows us to, you know, understand that, you know, the need for psychologists is quite large, especially within neuropsychology. More recently, there's been a lot of awareness and education around the impact of the brain, the role then that neuropsychologists play, that, you know, have this specialized knowledge and understanding how the brain impacts behaviors and thinking skills, especially in the public health setting. There's been, you know, the increased awareness has resulted in, you know, lots of like new opportunities and jobs that have been marketed. I've, you know, been recently, having finished the master's component of my, you know, neuropsychology training, been looking for jobs, and you know, the opportunities that are out there, they're vast and varied, and it's awesome to sort of, you know, see that. But I think it's just going back to what I was saying earlier about, you know, the two streams of thoughts. I think the increased demand, with also the, you know, the need for psychologists, it creates this sense of responsibility that I think psychologists need to be mindful of. You know, we want to be providing the best care, so striving to be our best selves so we can support clients or patients in the best way, especially in this, you know, in the time that we're in, where, you know, the difficulties, where we're seeing more mental health difficulties now than we ever have before.
And finally, if I may, it's interesting that the pathways to becoming a psychologist are changing as well, with one of the more popular ways, the 4+2, now being sort of excluded from the pathways of being a psychologist, where you do your 4-year undergrad and 2 years of supervised practice out in the field. So it's going to be very interesting in future to see how universities react to this sort of change in supply of psychologists to meet the new and growing demand for them.
Yeah, no, absolutely. And it's good to know as well that there are so many opportunities, presenting themselves, and that students do have options between different degrees and how they want to go into the industry and what they want to specialize in. So thank you so much for both of your responses. That was really interesting. I do have a follow-up question for Joe. So we can either be a psychologist with a general registration or a psychologist with an area of practice endorsement. I was wondering if you could please share your insights on this and how we pursue various career pathways.
Sure, and it's a question that I often get asked by students between, you know, what's the difference between the generalist and the pathway to endorsement? They're quite different in terms of the training that you do. So with the sort of degree that Dominic did, it was a 1-year program, and then he's out working in the field for a year. At the end of that year, he'll do an exam, a national exam. Sorry to remind you about the exam, Dom. And then with DJ's, he does a 2-year degree and then does 1,000 hours worth of practical experience throughout that degree. And then at the end of it, there's no national exam for him to do, but then he joins a registrar program. So any of the people who do the 2-year programs go into a registrar program, which is 2 years of supervision, basically. It depends, and whether or not you choose to go the generalist pathway or the endorsement pathway really depends on how committed you are to working in that area. So if you were really definite about the fact you wanted to be a clinical neuropsychologist, then you do the 2-year pathway. But alternatively, you might know that you want to be a psychologist, but you're not so sure what type of psychologist and for you, practical experience is really important in getting out there and working, in which case the generalist registration route will give you a lot of flexibility because you'll be able to work in a very diverse range of different settings. So, you know, schools, corrective services, could be health, but it could be organisations as well. We see our graduates from the professional program going into all those different areas. So it is really a generalist degree that allows you the flexibility to go into those different sorts of pathways. But the training is quite different. So it depends on what you're looking for too in terms of training, as well as where and what you want to be doing when you're working.
Yeah, so you can sort of tailor it to what you want to do in the future, as you just said. That's really helpful. I do have another question for you, Jo. So what other trends can we expect to see in the psychology field that would give aspiring psychology students insights into their future careers?
I think it's really important to keep doing your research because there's always new and different career paths coming up. So for me, the most important thing about where you end up in psychology is understanding your strengths, understanding what your interests are and aspirations, and then choosing that pathway that's right for you. So doing research, for example, by going to the Australian Psychological Society website, there you'll find different interviews with psychologists from different areas of endorsement. There's even some videos, and that will help you get some more background about what it's like to be a psychologist working in those different types of areas, so that you can make a good informed decision about whether or not you go the generalist pathway or the endorsement pathway. And that can help to inform your decision. But like I say, I think a lot of the jobs that are available in the future haven't even been designed yet. So being flexible and continuing to learn, I think, is really important as well. Coming into it with that growth mindset where you're continuing to do professional development in new and different areas. Dom and I were speaking earlier, and he reminded me that, you know, after the generalist pathway, in the future, we think it's very likely there'll be bridging courses into the different areas of endorsement. So you don't need to rush in and try to do it all at once. The government's probably going to have you working until you're 70, which isn't great news, I know, for many of us, but the very fact is it gives you a long time to achieve different things during your career. So sometimes taking a step back and working out what it is that you want to do next can be time well spent.
I really love that your response centered around giving advice to future students, because that does flow very well onto the next question I have here. And that's for Dominic and DJ. So if there's one piece of advice that you could give to future students, or perhaps that you would have wanted to hear when you were a student thinking about masters and future psychology, what would that piece of advice be?
It's a good question. I never think to myself that I'm one to, you know, offer advice. But if I had to look back and just think about my own journeys and the journeys of my friends and colleagues in the space, I think often what's sort of said is, you know, if you want to progress into one of these postgraduate psychology programs, you know, it is always a really good idea to make sure that, you know, your academics throughout university are, you know, you're keeping them stable, you're doing okay with them. You know, they're not the be all end all, but they do make a difference. So if you are in a position to, you know, impact how your grades are going, I think that's something to focus on. But outside of sort of university, I like what Jo said earlier about aspirations and figuring out your strengths, and then seeking opportunities that align with your interests, that align with your strengths, and also provide you opportunities to grow personally and professionally. The sort of fundamental criteria of a psychologist is to provide care to a patient or a client, and to be able to connect meaningfully with them. So seeking opportunities that allow you to do that, and they don't always have to be in the mental health space. They can be across various different opportunities that build those sort of like interpersonal skills, those soft skills that are so crucial to work in this profession.
Now I'm going to put my hand up and just say that DJ's stolen my answer, but I think what is really important for anyone maybe that's hearing get experience and rolling your eyes, I can almost feel it happening now as we're recording this. It can be difficult to get experience to be experienced to get a job or get into masters, but there are some really good options for it. I spent a lot of time as a volunteer telephone counsellor for one of the big services. And then, that turned into a work opportunity as well, which became unhealthy, but, you've got to keep balancing all that stuff. So if you look hard enough, you will find the sort of opportunities that will give you that experience. And to further emphasize on what DJ was saying, it doesn't have to be mental health, but if you can find an opportunity which involves a lot of one-to-one communication skills, really just working on your communication skills, because communication is one of the key things about being a psychologist. If you can't communicate very well, then you're going to have a lot of trouble with clients. And also, a lot of introspection is good too, just in terms of asking yourself why you want to be a psychologist. Not only because that's probably what Joan might ask you if you go to one of her interviews for the postgraduate course, but also because I've had friends tell me that they started off after doing some study in a job as being a psychologist, and they told me that they realized it wasn't for them. So you've really got to make sure that it is for you and you're that sort of person. I got into psychology originally because I wanted to beat another person in my school who I was academic rivals with at psychology at uni, which wasn't the best reason to get involved with it at the start. But over that course of 4 years and the work that I did as a telephone counsellor, it evolved into more obviously helping people. So you need to make sure you're doing it for the right reason.
Some amazing pieces of advice. Thank you so much to Joe, Dominic and DJ for a really informative and inspirational session. And thank you to everyone for watching this video as well.
Thank you so much. That was a really informative and inspirational panel discussion. I know it raised a lot of questions for me and also in turn answered a lot of questions for me. So I hope you all have found that just as interesting as myself and the other panelists did. I can see the questions flowing in from you guys, which is really great. So if you do have any questions throughout this next panel discussion, we will be moving on to our Q&A now. So pop them in the function on the bottom of your toolbar. And like I said, if we don't get to all the questions, you will get an emailed response to you in the next few business days. So I will open up to both of you, Dr. Gilchrist and Professor Wiggins. If you were to say what a day in the life of a psychologist looks like, what would you say? Is there actually a regular day in the life? Does it fluctuate where you are that day? If you're at university, if you're with patients. Professor Wiggins, if you'd like to start, can you kind of run me through what a typical day could look like for you?
So as an organisational psychologist, of course, I'll take that view. So my work as a practising psychologist can range from working with a group developing a mental health framework for new trains to helping someone return to work who has been involved in an injury or some kind of accident. So you can go from dealing with systemic issues through to individual issues. In the course of a day, you might be employed as a consultant. So you'll be as an external consultant. So you might be dealing with different organizations during a day. You could also be an internal consultant. So within the organization, you might be deployed to different parts of the organization, or you might have a particular role. So a lot of our students now are working in, Joe mentioned, human factors and user experience. So they're working on systems, internet systems and websites and things like that. So they might have that as a goal, but it's extremely varied in the context of organizational psychology. Probably a little bit different to what happens in clinical, I would imagine.
Dr. Gilchrist, would you like to give us a little bit more information for the clinical side?
Yeah, so for a clinical psychologist, they'd be more focused on the individual and the well-being and mental health of the individual. So it may be in the context of a multidisciplinary team or trying to help that individual within a context that includes systemic issues. like the example I gave earlier with patients' well-being in medical settings, for example. But that wouldn't be unique to a clinical psychologist's role. More typical example would be, certainly bulk of the training would be psychotherapy, right? So to interpret and synthesize different aspects of a clinical assessment, which could include observation, self-report tools, other methods and tools. So synthesizing and interpreting that assessment to come up with a formulation or conceptualization, an understanding of the problem, so that you can come to not necessarily a diagnosis, but it could be, and then an approach to address that problem. So a typical day might be, some years, you know, a typical day for me was 5, 6, 7 clients throughout the day, each day, most of the week, where I'd work with, you know, anxiety disorders or depression, one-on-one sort of cognitive behavioral approaches. So you talk about thoughts and the behaviors that may maintain or worsen their problems and how to take control of their symptoms. So that could be one example. Another typical day in a more hospital type setting would be a bit of that, but maybe the bulk of it would be working and consulting and meeting with other health professionals to help gain a more complex understanding of the problem. So those are fun days as well. And more recently, I'd say what's different in academia. Every day is a little different, but won't talk about that.
It's not bad.
Both for that.
No, that's good. It's good. It's just hard to define what a typical day is here. That's all.
Yes, our roles are a bit different because we have practice as well as academia. So
yeah,
definitely. And I think you both highlighted, as of course you do have that balance of practice and academia, which I'm sure does make it a little bit trickier. But it's very interesting to see that you guys highlighted quite different day in the lives if you had that practice. So potentially for students that know where they want to end up in their career, but aren't really sure which psychology route takes them there. I'm sure that was a really helpful answer. So thank you for that. I will follow up with this question from a student who is interested in studying a Master's of Clinical Psych, and they're set to do their honours next year, but they're wondering if completing their honours part-time will impact their ability to gain acceptance. So in other words, are students who studied honours full-time more favoured? Is the work-life balance of doing part-time less favoured for any reason? Professor Wiggins, I might start off with you, and Dr. Gilchrist, if you have any additional comments, of course, feel free.
Well, certainly not for the org program. We don't really discriminate on the basis of how you did your degree, but the rules are quite clear that you must achieve at least a second-class Division 1 honours, and that's a minimum requirement for any postgraduate degree. But we certainly don't discriminate between the way in which you would have done your honours degree. Philip?
Yeah, so similar for us. So short answer to the question, no, we don't discriminate. So if it's an honours degree and meets those cutoffs, then it's considered like any other application.
Awesome. And that's really interesting to hear, because I know a lot of students, and I felt this when I was applying for programs myself, and I'm sure a lot of students you both talked to felt this as well, the work-life balance of being able to study at university, especially with honours and those upper programs, and then also potentially having a job, having a family life does get a little bit tricky. So knowing that they do have that flexibility and that Macquarie that's really supported, I'm sure has eased a lot of concern. So thank you both very much for that.
Ella, can I just jump in there just for to make
Absolutely.
one point? That's the process of entry. I think Philip and I would both venture to suggest that the degrees themselves are quite demanding. They can be done part-time, but once you're in that degree, it's, there's 1,000 hours of placement in addition to your university studies. And So I just wanted to make that point because they tend to be fairly demanding programs in terms of the time involved. Sorry to interrupt.
Definitely.
But
No, thank you so much for that. And it's good to hear for students so they know what they're getting into. The worst thing that could happen to a student is the unknown and not knowing what they were signing up for. So thank you for that. I really do appreciate the interjection. We have a student who they're considering both clinical and organisational. They find them both extremely interesting, but really are having a hard time choosing between the two of them. Can you get an organisational degree and practice in a clinical setting as a clinical psych, or is this something that doesn't really commonly exist? If either of you have a strong response, feel free to jump in.
That's a good question. I think I might defer to Mark to start off.
Look, one of the basic principles in being a psychologist is knowing your boundaries. And so we train people, certainly our students will do counselling, but they'll focus on coaching, they'll focus on individuals, but it's about development. We won't deal with psychopathology. That's the role of the clinical psychologist. And it's very important that we don't cross that boundary. So for example, if I see a client and I'm trying to return that client to work and I perceive there to be a psychopathology, I'll refer that person to a clinical psych. I will not deal with the psychopathology because it's outside my area of practice. However, as Joe mentioned, there are strategies now where you can do an org degree and then you can do another year and you can attach an area of practice endorsement in clinical psychology onto that now. Now, we don't do it at Macquarie, but there are strategies where people are combining different programs, but effectively it means doing another year of study at the very least. And some programs are doing this. I think the University of Southern Queensland's doing this or something like that. So it is possible, but I would be very, very cautious about knowing your boundaries.
Definitely.
Yeah, I agree with that. I think that's a very good point. And so, you know, if you're a clinical psychologist working in a context, trying to help the individual, and some of the case formulation suggests that the context is actually exacerbating or worsening the problem, we wouldn't go and you sort of know your limits, and you wouldn't go and try and intervene at an organizational level, but you may consider the fact that it's a contributing factor, and you know, you could consult, but you'd still like the practical aspects, your interventions are got to stick to your practice. Yeah, so that's a good point that Mark made. I agree with everything he said.
Thank you both for that. And I think, again, Professor Wiggins, what you said about not overstepping those boundaries and knowing that there are other psychologists and other healthcare professionals that are able to fill in those gaps that you aren't equipped to deal with in your specific profession is really interesting. And it also really feeds into the fact that when you are practicing, you're not practicing as that single entity. There's always others around you to help patients and allow them to feel really supported in whatever their individual journey is. So thank you both for highlighting that.
I just thought I'd just add to that. Sorry,
Absolutely.
another interjection. One of the nice things about Macquarie that I think is incredibly valuable is that we have the 3 programs, or in fact the 4 programs, because we have the general psychs as well, working together, and they get to know each other. And that's important because you develop a referral strategy, really. So you understand who's focusing. So which of the clinical psychs focuses on pediatrics, or which of the clinical psychs focuses on anxiety disorders. And so you develop this capability. And it's, I think, one of the unique aspects of Macquarie, because we have the 3 programs or the 4 programs, you actually build up this knowledge of other areas, of other specialties, but who's actually doing the work.
That's very interesting. And again, thank you for highlighting that. And in a lot of programs, and as you've highlighted, especially in these 3 or 4 programs, it makes Macquarie very specialised and very unique in our approach, that you aren't in your degree, you don't just know the people in that niche degree, you are, with and mingling and working alongside those others, as you said, to learn more about what they're studying and be able to take that into your professional practice, which I'm sure is a very important skill, and learning that in university through tertiary studies would really help in the future careers as well. For clinical psychology, could you speak about the placement requirements and how many hours or days a week are typically required? The student is trying to figure out how many paid work hours they can do on the side. Is that something that's doable? Is it something that you should just take your clinical psych hours on their own and save work for when they're finished? Can you provide a little bit of insight on that for us?
Right, it's a good question. So just to echo a bit of what Mark was saying earlier, I think it relates a bit to this question, because you can certainly work, but from my experience here at Macquarie, the past couple of years, the students with full-time load and work more than just a few hours a week find it incredibly difficult. There is some variability in terms of the hours put into the placements. It's 1,000 hours, though there is some variability from site to site. There's some slight variability. Some of that depends on student preferences. So some students get excited and spend a bit more time there. I try to discourage that to manage their workload, so that they spend enough time on the academic units as well, which are equally important. So for the first placement that's in-house, you're looking at about roughly maybe 2 days a week, spread over roughly 12 months on average. There is some variability depending on the tasks and the demand at any given time, but that's roughly what it is for the first placement. And then in your second year, you'll have 2 external placements, and then grand total, we have around 1,000 hours.
And I think, thank you for that insight and clarification. And I think, again, knowing what you're getting into when you do enroll in these degrees is almost half the battle, knowing how to plan your time, what accommodations you might need to make for a few years in order to get those 1,000 hours up and be able to keep up with your academic work. So thank you for providing a little bit more detail and clarification on that. I will give this question first to Professor Wiggins. This question was highlighted in the video that we watched. I've heard that we need to pay for our professional supervision hours. Is this true or still the case? And how many hours would we need to pay for?
Okay, so I think in the video, they were making the distinction between registrar and placement. So in the context of the degree, you pay your unit fees, which effectively means that you're paying for your placements. So your placements are part of the degree. There is no additional cost for a placement. Now, that when you finish your master's degree, you will receive, this is for the area of practice endorsement, you will receive general registration with the Australian Health Practitioners Regulation Agency. To become a clinical psych, an org psych, or a neuropsych, you need to do an additional 2 years after the master's degree, which is called the registrar program. It's very similar to the medical program. So think of it like you're becoming a specialist, and you've got the academic side of it, you've done your placement, and we call those placement hours, and then you'll do registrar. Now, normally people are working at that point, and the supervision is organised by the student. Now, the student is no longer a part of Macquarie University, and sometimes we supervise. So we will supervise the student, but And you mentioned that, well, in the video, they mentioned that someone was being supervised. It was Dominic was being supervised by his boss. Sometimes you can be employed in an organization where your supervisor, as in your manager, is an authorized supervisor and can supervise you for registration purposes. So it doesn't actually cost you anything. So it depends on the situation, but that's where the cost comes in. It's a registrar, it's post the degree. But it's very important to do that 2-year registrar program, because that's when you actually become the clinical psych, the org psych, or the neuropsych. Okay. When you finish the degree, you receive general psych, you become a general psychologist. Okay.
Thank you for that clarification, because I know for a lot of students, and that is quite a few of the questions that we are getting, are a little bit confused on that process and the timeline like you outlined. So thank you for kind of giving them a little bit more insight on the timeline and, you know, what happens at each step and what they'll need to do as either students of Macquarie or when they are alumni and when they are practicing. So thank you for that clarification. A little bit more of a general question next, and I'll head to Professor Wiggins first and then Dr. Gilchrist, of course, with your comments as well. What are the personality traits or attributes that you found are required for psychologists? Are there specific traits in each of the fields that you're in that are kind of desirable? Of course, you get a really wide range of psychologists, but are there traits where you see students and you think that would make a great psychologist?
Good.
Well, this is an open one, isn't it, Philip? So the simple answer is, look, extroverts are org psychs and introverts are clinical psychs. No, I'm just joking. But it tends to be, you look, to be an org psych, you need to be comfortable with groups. You need to be comfortable with people. You need to have a degree of confidence. You know, you need to be agreeable. I don't think that there is one personality that suits being a psychologist. I think what you really need to do is to care. You need to care for people, whether it's in an organizational setting or whether it's with individuals. You need to have a degree of empathy. And I think that's what we look for more than anything else, that you genuinely want to help people. You're not doing this because it's for the money. You're not doing this because it's prestige. You're doing this because you genuinely want to help. We are psychologists, and you know, the speakers in the video said this, that you really just need to want to help people, and then we use an evidence-based strategy to do that. Philip, you might have a different view.
I think that's an excellent explanation of what we're looking for in clinical as well. So you could be introvert or extrovert, but if you don't like people, that's something else, and that is a problem. So you could certainly be quiet, soft-spoken, and introvert and be an excellent psychologist. You could be extrovert, so that's, I think, not an issue. Wanting to help people, so I agree with that as well. So capacity for empathy, care, and wanting to help. I would add to that, we wouldn't want someone who has a pathological need to fix people, though. So there can be that, which is something else we could discuss, because there are circumstances where we're limited and we could help people up to a certain extent. And if that's something that you can't handle and it frustrates you or leads you to behave unhelpful ways, then that's not good. So a bit of, I would add maybe a bit of humility is useful sometimes, as you know, knowing the extent of what you know and what you don't know, and what you don't know that you don't know, and how important this is in our career, because we are constantly learning. I mean, so at another, I guess I don't mean to derail the conversation. I'll stick to the point, but it relates to this other point where it's constantly, you have to constantly open-minded, but skeptical, so that you could be a good recipient of the evolving knowledge from year to year. Because every year I'm learning something new, and you should be learning something new every year, because the field is constantly changing. So it's not a technical degree. It can't be a technical thing. You can't only learn technique. You have to learn how to think critically, how to case formulate, how to conceptualize, and yeah. So anyway, so I'll stop there.
No worries at all. And I liked how you both kind of highlighted that there isn't a hard and fast rule for either org or clinical psychs, how it is an ever-changing practice. You're still lifelong learners when you get into the practice. If you're practicing, if you're in academia, if like you're both of you are balancing both. So thank you for highlighting that. And I'm sure a lot of students will kind of resonate with that. This might be our last or second last question. So I might end on a more general one to try and show students why they should be choosing the programs at Macquarie. So Professor Wiggins, I'll begin with you. Why would you think that the Macquarie Org Psych programs, why do they set us apart? What do you think are unique about ours, or that students often really highlight as something that they love from our programs?
So I think there are a few reasons why I think Macquarie is a good choice. I like to think of Macquarie as the applied psych university in New South Wales. The focus of our research, the quality of our staff, it's about practice, evidence-based practice. Most of us have this combination of practice experience and academic skills, and we try and bring those together. We're not pure academics. We are practicing psychologists, and I think that really adds value to students. We're talking about things we've actually done, and we can talk about when things don't work, as Philip said. You know, we've tried it, we've tried this particular perspective and it doesn't work. So we're trying to give students a realistic, genuine sort of stepping stone into the workplace. That's the first issue, the quality of our staff. The second issue, I think, is the fact that we have these programs. We have 3 programs. We're the only university with a combination of programs. And I think you learn about other specialties, which I think is I mean, I work with the clinical psychs and the neuropsychs, and that adds value to my practice. And I think that's very important. The quality of the placements. So we have very high quality placements. We go through a rigorous process of making sure the placements are right for students. We monitor students. So I think probably I'll leave it there, but and we really do enjoy, particularly at these, I mean, Philip and I teach it in, at these master's levels, and we really enjoy it. We enjoy talking to the students, we enjoy mentoring, and what we're doing is creating a sort of a college of practice. The students I've taught for the last 10 years are students I now work with in practice. That's the way it works. I see them all the time, and we're sort of building this community of practice. I'll leave that there.
Thank you so much for that. And Dr. Gilchrist, anything that you would add?
Yeah, I agree. I haven't met anyone at Macquarie who doesn't enjoy the act of teaching. So there might be, aches and pains here and there for various reasons, like any job. But the actual act of teaching, I think everyone in our program really is passionate about it, and they have different wealth of experience to draw upon. So some they're just world leaders in child anxiety, child CBT. Some are very specialized in more health psych related models, and they all come in with these different backgrounds and a wealth of applied backgrounds. At the same time, also strong researchers and critical thinkers. So it lends nicely to the basis of our program, which is scientist practitioner model of clinical psychology, which emphasizes like evidence-based way of assessing the problem, of then formulating the problem and approaches to dealing with it. And that has to be based upon both theory models and clinical expertise, as well as client preferences to be evidence-based. So So yeah, I think we have all these different sort of pillars to draw upon. So I think that's exciting to work in that environment with staff who are passionate about training, learning, and teaching. And research.
Thank you both so much for that. And I know that the students online, I'm sure, and myself would have got to get a lot of out of that, knowing that Macquarie does set ourselves apart, not just on the content that we teach, but also, like you said, the teaching quality, the passion, the fact that you all are practicing, you're in the profession that you're teaching on. So it makes it all very relevant. And you therefore create lifelong learners out of the degree, which I think is a really great attribute. So thank you very much for both of you for highlighting that. Unfortunately, that does bring us to the end of our webinar on becoming a practicing psychologist. I know for myself, and I'm sure everyone else on the Zoom this evening, that you have really gotten a lot from that. So please join me in thanking Dr. Gilchrist and Professor Wiggins for their time this evening. I'm sure that you are both very busy with the balance that is life and work and academia and everything else in between. So thank you both very much for joining us. And on behalf of Macquarie, I'm sure that a lot of students will have gotten a lot out of this. So I would just like to thank you both again very much. If you do have any more questions, you can always reach out to us for any advice. We will share any contact details in the chat at the function at the very bottom of your toolbar. And like I said, if we didn't get to your question this evening in the Q&A, so firstly, thank you all so much for being so engaged with that. It's great to see you having so many questions and really loving what the panelists had to say tonight. If we didn't get to your question, we will email you a response in the next few business days. If you would like to be considered for the intake in this program for next year, do remember that your UAC applications will be due by the 31st of October. So you still do have a little while to make your mind up, but do just keep that deadline in mind if you hope that this program is for you next year. And at the end of the expo, you'll receive detailed information, including all the contact details, how to book a one-on-one consult, and any more information you need on making the step to come and study with us at Macquarie. So take the next few days to think of any additional questions you might have, and the link that will come in that email is the perfect chance to have a one-on-one at the Zoom chat, or hopefully we'll be back to face-to-face very soon to answer all of those questions. So on behalf of Macquarie, we really are looking forward to welcoming you all very soon, hopefully. Take care and have a great evening.